Broadcasting from the business capital of the world, this is the Podcast Business News Network. Welcome back to the show. Amy Hunt joining us. We have Missy as well from Simply Bliss Med Spa. Excited the ladies are back here to talk a little about love. Love is in the air, love hormones, and so much more. But from the Simply Bliss Med Spa and Wellness, we're excited they're back, to talk more about all the work they're doing. And of course, at Simply Bliss, all the wellness experts are in the house today for the Valentine's season. How's it going, girls?
Great. How you doing?
Good. And Missy, I'm sorry, I forgot your last name.
It's Ritonya.
Ritonya, thank you, because it's not in my notes, so I never know it. I just know it's Missy. So, all right, thank you so much. So please introduce yourself and tell us a little bit about what Simply Bliss Med Spa is all about.
So I'm Amy Hunt. I'm the owner. I'm a nurse, RN here. Been in business for about 6 years. I've been in the industry for 15. And we just had an open house because we're super excited. We're in a new location. Been here about a year. And Missy is going to talk about GLP-1, which is a really hot item right now. And so love is in the air. GLP-1 yourself if you love yourself. And then we're also going to talk about oxytocin and
PT-141.
Okay, so I'll let Missy introduce herself.
Yeah, so my name is Missy Ritonya, and I'm the nurse practitioner here at Simply Bliss and the medical director. I am in charge of doing all things hormone related, weight loss, plus I'm an injector. And so kind of do a little bit of everything. And today for our last podcast with you, we'd like to kind of zone in and focus in on the GLP-1s, what makes them important. And in addition to being the month of love, talk about our 2 peptides that kind of fall into that category. So kind of kicking it off, GLP-1s are weight loss medications that we use. And this is a great time we always say you build your summer bodies in the winter. And so starting to think about weight loss, New Year's resolutions always have something to do with health and wellness. And so this would fit right on in for people. GLP-1s are something that are kind of the hot item right now for weight loss.
And what is GLP? What does it even mean? Could you give me the long term?
Yeah. So a GLP-1, that's just the abbreviation. What it is it's called a glucagon-like peptide 1. And basically what it is it's just a hormone that plays a role. It's a hormone that we already have in our body. But what it does is it plays an important role in regulating blood sugar levels, our appetite, and our insulin secretion. It's already produced in our gut, primarily in the intestines, and it is released in response to food intake. So how it works and what makes it important is there's several key benefits to it, especially when it comes to managing conditions like type 2 diabetes, which is what these medications were originally FDA approved for. And then they got a secondary indication for obesity and weight loss. What makes them unique is how they work within the body, and how they work within the body is what makes them pretty amazing and all the wonderful benefits that they offer to patients. The first thing that it does is it controls blood sugar. How it does that is the GLP-1 hormone actually helps your pancreas release more insulin in response to food that we eat, which that helps aid in lowering our blood sugars after we eat. It also inhibits a glucagon release, and glucagon is another hormone that we have in our body, which causes blood sugars to raise. And so by inhibiting glucagon, it helps reduce the amount of glucose that's being released from our liver, preventing times of high blood sugar. And then it also improves our blood sugar control through both of those mechanisms, but helping really to regulate blood sugar levels in a more stable manner in patients, especially for people who have type 2 diabetes. So that's kind of like how it works within our body. But why we use it for weight loss is because it actually works on reducing appetite. And so the GLP-1 helps reduce hunger by working on the brain, the appetite centers within our brain, which leads to an overall reduced food intake and helps with weight loss in general. It also helps by slowing down gastric emptying. So what happens is by taking these medication, it slows down the rate in which food leaves your stomach. So it helps make patients or people who take these medications full for a longer period of time,
Ah.
which helps lead to us not overeating and staying full for a longer period of time. And so I always tell my patients that it kind of helps with that brain gut connection again, because after you eat, because you're full, it sends those signals back up to your brain to basically tell your brain to feel full. So throughout the day, you're not going to have those cravings where you're like, oh, there's candy. I think I want to eat it. Or, overeating your plate because it takes so long for that food to digest that you physically don't have food to or room to eat more food than what your body can handle.
Which is satiety, and you hear that a little bit now with when we hear about these meds that increases satiety, which is
That feeling of being
being
full.
full. Yeah.
So that's how it works with weight loss. The benefits of these medications are, what they're finding over time with the more that we use them is there's actually health benefits associated with them, such as cardiovascular health. And so you can get improved heart health through some of the studies that they have found is that it's lowering the risk of major cardiovascular events like heart attacks and strokes. And that's particularly important for people who have type 2 diabetes because they're already at an increased risk for heart disease in general. It also helps with reducing blood pressure. And as we know, like when you're overweight, sometimes you tend to have higher blood pressure. So especially as we're losing weight, we're seeing that reduced need for blood pressure medications.
And just curious about the hormones that we've been talking about, though. How do you even get them? Is it an injection? Where's the injection? How often?
Yeah.
Is it a pill? Is it injection sites? I'm not even sure because I know there's quite a few.
There is quite a few. So the GLP-1s primarily are done through an injection that you do once a week subcutaneously, so into fatty tissue. There is also other ways that you can do them for people who don't like to do injections or have a fear of needles. You can take it orally. We have rapid dissolvable tablets, and there's also drops that you can take. When you start doing it orally or using the drops, you usually do them once or twice a day, every day, whereas the injections are once a week, sometimes twice a week, depending on how well somebody tolerates those medications.
Thank you. Thank you. Go ahead. Continue.
Yeah. Yeah. So then other benefits that we're seeing with the GLP-1s are that back again to metabolic things that we're seeing is improved triglycerides. They also are seeing that there's neuroprotective benefits from it. So brain health, which is a big thing. They're seeing that GLPs can have some neuroprotective effects, including brain function and possibly reducing the risk for neurodegenerative diseases like Alzheimer's disease. So right now that's kind of the hot topic where they're still doing a ton of research into, but they're seeing a lot of positive benefits for that. And then it helps with overall metabolic syndrome. And that's kind of been a hot word in probably the last like 5 or 10 years. We hear this term metabolic syndrome. And what it is it's just a grouping of symptoms that patients have related to basically our body's not doing what what they should do over time. And so a lot of times you see high cholesterol, high blood pressure, insulin resistance, and those patients typically have a larger or bigger belly fat.
Girth, yeah.
And so
And hypertension, right?
Hypertension. Mhm.
So there's 5 indications of metabolic syndrome, and that's usually what your doctor will tell you. You're headed for diabetes, you have metabolic syndrome. Insulin resistance being one of those, and then, like she said, the other thing. So it's really nice that it can
work
reduce
overall.
that, yeah.
So more than just weight loss, but you're getting a lot of, benefits overall from those GLP-1s.
Basically anti-aging, really, if you think about it, and then how it repairs the gut.
Yep, so it helps with any kind of leaky gut, which helps with inflammation,
Right.
like whole body inflammation. And so we have a lot of people who come in who have autoimmune disorders, that have a lot of whole body inflammation. And when we start them on these GLP-1s, their inflammation dramatically improves with them. So it's really neat to watch and see these improvements in patients. And we're excited to be able to offer them to patients.
And we're excited because we just started a collaboration with a new compounding company out of St. Louis. I can't remember the name.
Genesis.
So in that, we also are able now to get that medication a little less, and so we'd like to pass that on to our clients as well. So
And how is it regulated? Or isn't there some that aren't? They're off-market label brand, but they do the same thing. What is the regulation process like? And there's all different sorts, right?
right.
Yeah. So what you are going to get, so there's branded medications that go through the whole process of getting FDA approved, and they are made through pharmaceutical manufacturers. And those are going to be the branded medications. So when you see commercials for them, it's going to be Mounjaro, it's going to be your Ozempic. For weight loss, it's Wegovy and Zepbound. What we're using is, and so those are very highly regulated through pharmaceutical companies and through management programs that you typically will be able to use your insurance to get. They're also very expensive. And so what we have been able to do is work with compounding pharmacy where they use the actual active ingredient. So for example, the active ingredient of Ozempic is semaglutide, and the active ingredient of Mounjaro is tirzepatide. So they're using the same active ingredients, but they're compounding it with an additional usually an amino acid or a vitamin B12 to make it a little different than the branded versions of them. But still with high purity and high testing, they go through their whole process of being regulated. But this allows us basically to offer these medications to patients at a little bit more cost affordable, but they're still getting high quality products. So yeah, to kind of answer your questions, where do you get them from and pricing? So,
So it's legal to take an off-brand medication. I'm assuming it is.
So
I don't know.
as long as the biggest thing is what people are saying about compounding pharmacies. So you'll hear a lot of negativity against compounding pharmacies. And that typically just comes from drug manufacturers, because they will tell you that you should never buy
good
or compounded pharmacy, because of course,
it's their competition.
Yes, absolutely. Okay.
Yeah, and so you're going to hear a lot of, there's a lot of people, doctors specifically, who would never get anything from a compounding pharmacy. But compounding, if you have a great compounding pharmacy that you use that is trusted, that uses regulations to manage and promote their products, they are absolutely safe. And it's a great way to make a medication very specific for your patient. So when you get manufactured drugs from the drug company, you get it how it is, how it's made, how it went through their testing process, and they can't veer outside of that. So for us, when I use a compounding pharmacy, if I have a patient who comes in and they don't necessarily need the dosing of the medication that the drug maker has, maybe they need something tweaked a little bit, or for example, with the semaglutide or the tirzepatide, if we wanted to add a B12 in there, B12 helps with nauseousness and it helps with some of the side effects of the medication. You can't do that with the branded medications, but I can do that with a compounded version of it because my pharmacist can make it specifically for my patients. And so to me, using a compounding pharmacy just kind of helps you give a more tailored response or
Yeah.
tailored.
Do you still
Well,
need a prescription for this
yeah, you
compounding
sure do.
pharmacy? Okay, okay, thank you.
Yeah.
And I believe, correct me if I'm wrong, compounding pharmacies are scrutinized way heavier
Mhm.
and with way more regulations than say a Walgreens or something like that. Mostly because they're making them there. But I mean, it's not like they're just like fly by night in the back of a warehouse, you know, type of a thing. Like compounders have to go through a lot to get what would it be,
To have their
licensed?
license,
Yeah.
yeah.
So, we've always used, so we, in functional type medicine, the kind of medicine that we do, lifestyle medicine, we almost always use a compounder. And we have compounders here in Omaha that we use locally. And then almost all of our medications come
Come
from.
from a compounding
So we're
pharmacy.
excited to collaborate with one a little closer. I actually live just a mile off the border of Missouri, and now we get to play with some nice folks down in St. Louis. So we're excited about it.
Got it. Awesome. So when you're like when someone comes to you for like the hormonal testing and stuff, are these compounded? I'm trying to learn. You're teaching me so much today about compounded
Mhm.
medications. So is it like more on the hormonal side as well? You're making it custom for that person's body in a sense, what they're lacking, what you see in
Absolutely.
their blood work.
Yes.
Yeah,
Okay, thank you. Thank you.
yeah.
Thank you.
And we talked a couple weeks ago a little bit about peptides,
Yes.
healing peptides, BPC 157, TB 500.
Oh, now you're getting all fancy on me, but yes, I
Uh-huh. So like healing ones, and then as well as we get the oxytocin and
The PT 141.
from compounders as well. You're not able to just get that from a pharmacy. We're going through compounders for that as well. And so Missy was going to talk a little bit about the love hormone of oxytocin, and then I never can remember the other one,
It's
Missy.
PT 141. So that's
PT 141.
yeah, kind of in that whole sexual health realm of things, especially it's appropriate for the month of December,
Yeah.
the love month. And so kind of going into that, we do have two really great peptides that we can use within that sexual health, sexual function area. One of them is oxytocin, and you've probably heard that name before. It is a hormone that's made within our body. It's a hormone and a neurotransmitter, so it's very unique in the way that it works, but it plays a critical role in various psychological processes, especially related to things like social bonding, reproduction, and then emotional regulation. And as Amy mentioned, it's often referred to as the love hormone or a bonding hormone.
And it's what we release when we breastfeed our child.
Mhm.
Oxytocin is required for the letdown of your milk when you're nursing a baby.
Bonding.
And so then with that, you get this beautiful bonding as well. So we can get it as a nasal spray
Mhm. Or an injection.
or an injection. And so you can take that and bond with your
Significant
other,
Ah.
your
Yeah.
girlfriends, if you were out having a Galentine's and you were, it's just it does make you feel closer. I've used the spray.
Yep. So it's unique in the way that it works. It helps promote, like Amy was saying, social bonding and trust. And that's because you release oxytocin naturally. So oxytocin is naturally produced in our hypothalamus, but it's secreted by our pituitary gland in response to things that stimulate us to kind of feel good and bond. And so during social interactions, you release it through things like touching or hugging, or sometimes even just eye contact with people. And so that's kind of where it fosters its name, like that love or social like hormone. How we use it here in the clinic is, as Amy said, we can get it as a nasal spray. You can get it as a rapid dissolvable tablet. And why you would use it is for situations where like you want that close connection with people, but it also works as an anti-anxiety medication. And so it helps kind of calming within our neurotransmitters. So it works on the opposite of stress cortisol. And so people, like, it has physically shown when people are in stressful situations, they can use oxytocin prior to going in, and it actually has an effect where it can lower your heart rate and lessen that physical response in times of high stress. But otherwise, overall, it just kind of enhances that emotional regulation and well-being. So it can promote emotions for people who have problems with empathy or love or trust. It helps improve your mood and emotional stability. So it can be it helps with feelings of happiness, safety, boosts overall mental wellness. They have studies that show it can improve social interaction. So people who have some social anxiety can use oxytocin prior to going into an engagement, which can help them feel make it easier for them to connect with others, reduce social fears, kind of open up those environments a little bit more. So it can be used in a lot of different ways other than just kind of the love hormone, but just kind of overall anxiety and stressful situations. So that one's kind of a fun, unique one that we have available. With any of our peptides that we have, we do require that you come in for a consultation first, just to ask, some background information and make sure that these would be appropriate hormones for us to prescribe to you, because of course in certain situations they can be potentially dangerous. And so we just want to make sure that we're asking all the right questions and we're prescribing something for you that's going to be helpful and not hurtful.
Beautiful.
And then the next one that we are calling the love hormone, and it really is more about, well, Missy can tell you.
So the next one is PT141, and it's a unique peptide that we have that is very specific to enhancing sexual function. So this one plays a role in arousal, libido, and sexual behavior. It's different than medications like Viagra, which work on affecting blood flow specifically to the genital area. This one actually works by acting on your central nervous system to increase sexual desire. So it's
sensitivity, right?
Sensitivity. And so it's a very cool peptide that we have that we can offer to patients in the form of injections and nasal sprays. And for why you would use it is because you would see, for people who have trouble with libido or decreased sexual desire, this is where we see this work the best for men and women. So it works on both. But it can definitely help boost libido. It helps with low sexual drive due to stress, like, factors like stress or hormonal imbalances, or even when you have some side effects from medications, such as SSRIs or antidepressants. This is a great one to use.
Muscle relaxers that make you, Yeah.
And then for men who have erectile dysfunction, this is going to work a little differently than, like I said, with Viagra. You can still use it in addition to, because it's working within that neurocognitive part of your brain, rather than that physical stimulation. And it can still help with arousal and improve sexual function.
Women.
And then women who have, there's so many different terms, but the newest one out there now is that they're kind of coining for women is hypoactive sexual desire disorder, which just basically means that you don't have
the sex
drive. The sex drive.
Okay. I'm like, that's like confusing. I'm like, wait, I'm trying to follow it. Yes. Okay. Low libido. Okay.
I haven't heard of HSDD, but it's a new.
Like when, especially females, when you're especially hormone, like when your hormones are imbalanced, And just, being a female who you have so many responsibilities, sometimes you do feel like you are lacking in that area. And so this is something that you can take quickly, in a situation.
It acts
And
fast.
it works very quickly. So within 30 minutes, you can go from having no desire to desire, and having increased sensitivities. So some of the times where we don't have the desire, it could be related to you just don't have the sensitivity down there. So you're like, oh, well, that
This
really
again.
wasn't exciting.
Right.
Yeah. And so now this can kind of bring that draw and excitement back into the bedroom, for males and females. And so it's really exciting for us to be able to offer this out to patients. But again, we still would want you to come in for a consultation first.
And we can do that via Zoom
Mhm.
if someone from out of state wanted something, yes?
Yeah,
It depends on if we
depends on
can,
the situation.
and it
Yeah.
depends on if we can mail it to them or not.
Yeah.
Got it. All right, good
But
to
they can
know.
certainly find a lifestyle, functional person in their area that is surely working with these things.
Yeah.
Yeah.
And what we like about it, or what I like about it the most, is that it has no impact on blood flow. So for people who have problems with erectile dysfunction, sometimes it's the blood flow, or you could be on medications that prevent you from being able to take a medication like Viagra or Cialis. So this would be the next best thing, because it has no impact on that. It's because it's not relying on that increased blood flow to the genital area. This is a really great option for those people who have any kind of underlying cardiovascular
Great.
issues.
Well, thank
It
you.
also reduces performance anxiety. So for people who have performance anxiety, this is really helpful because again, it's working on the brain and not necessarily depending on the blood flow in
Got
those
it.
areas. So yeah,
Thank you so much, girls, for being here. And
Yeah.
to wrap it up, remind us how we can reach you.
So, simplyblissmedspa.com. That's our website. And then info@simplyblissmedspa.com, and or contact at simplyblissmedspa.com. Phone number's 402-502-9868. And any of those will get you to us.
Perfect. Thank you so much, ladies. Happy Valentine's Day. Thanks for the conversation
you.
and all the knowledge, as always. I learned
Good
so
to
much,
see you.
and clearly everyone else must too. But thank you. I appreciate it. Have a great
Yeah.
weekend, girls.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.